Hi everyone, my name is Madison Larossignol, and today during my presentation, I'll be discussing the role of community-based participatory research in addressing access to resources for gender diverse individuals. To start, I'll do a brief introduction of community-based participatory research as a whole. Now, what exactly is CBPR? Community-based participatory research can be defined as a research model that is used to connect community members along with key stakeholders and ensure that both relevance and acceptability are maintained in the process of developing a community intervention. An important concept to keep in mind is power sharing. Power sharing in CBPR practice refers to an individual within the group equally sharing the work and responsibility required for the tasks, specifically referring to social inequalities. This ensures that throughout the research process, each individual within a given community has an equal say in the decision-making process, allowing for all thoughts to be shared. Now I'd like to discuss 3 different uses of community-based participatory research related to gender-affirming care. For the first example, I will discuss using CBPR to create a clinical support program for autistic, neurodiverse, and gender diverse individuals who have previously been excluded from existing support programs. The next example will discuss using CBPR to identify areas where healthcare expectations were not met by individuals within the transgender and gender nonconforming community. The last example discusses the use of CBPR in developing lasting community-driven interventions, specifically for gender diverse individuals that reside in communities that are geographically dispersed. The first example is a journal article written by Strang et al. Titled A Clinical Program for Transgender and Gender Diverse, Neurodiverse, and Autistic Adolescents, developed through community-based participatory design from the Journal of Clinical Child and Adolescent Psychology. In this example, CBPR was used in creating a clinical program for young people who identify as autistic, neurodiverse, or gender diverse, who may feel isolated or excluded from existing clinical support programs that were not developed to meet the needs of these individuals. The population of interest are youth who are categorized as autistic, neurodiverse, and gender diverse. Previous studies have shown an overlap between these categories. The research on this specific group, however, is not substantial. Throughout the use of CBPR in this study, the group identified any priorities for this clinical program that they thought were the most important. This group identified these priorities during the creation of the curriculum, which meant that their voices were directly included in the creation of the support program materials. The second example is a journal article written by Meyer et al. Titled Unmet Expectations in Healthcare Settings: Experiences of Transgender and Gender Diverse Adults in the Central Great Plains. This article uncovered the expectations that have not yet been fulfilled in the healthcare setting, as reported directly by the individuals within the transgender and gender nonconforming community. The population of interest for this study were participants that are at least 19 years of age and fell within the category of TGD, or transgender and gender diverse. Throughout the study, interviews were conducted in which the participants were asked open-ended questions about their personal experiences within the healthcare setting. The study was able to successfully identify 4 areas in which the individuals felt that their personal expectations were not met. These 4 areas were probing, gatekeeping, stigmatizing, and misgendering or dead naming. In using CBPR to identify these areas, the researchers then went on to discuss how health centers can improve in order to meet the currently unfulfilled expectations of their patients. And finally, the last journal article was written by Oakes et al., titled Community-Based Participatory Research with Invisible Geographically Dispersed Communities, Partnering with Lesbian, Gay, Bisexual, Transgender, and Queer Communities on the Central California Coast, from the Journal of Social Action in Counseling and Psychology. In this study, CBPR was used to develop a long-lasting community-driven intervention for gender-diverse individuals that reside in communities that are geographically dispersed. In these dispersed regions, these communities are often considered to be invisible. A community-based participatory research design was used for members within the LGBTQ+ population, and for the first time was not centered on a particular neighborhood or urban location, The population of interest for the study were young, gender-diverse individuals who are living on the central coast of California. Throughout the study, a multi-part video summit was conducted where community members came together remotely to discuss goals and create action plans, which were then taken on by smaller breakout groups to bring to life. Summit participants demonstrated great enthusiasm for the goals that were developed and provided one another with very thoughtful feedback about how to best attain them. Some groups came up with large goals, while others had smaller goals. For example, some participants envisioned building a centralized LGBTQ community rec center, while others created a plan for holding events like movie nights or potlucks at different private residences for individuals to travel to. Through the use of a community-based participatory research design in all of these studies, this ensured that all community members' voices were heard in the discussion of creating these interventions. The use of CBPR in the first study allowed researchers to gather feedback from the children's parents as well as key stakeholders in the community to establish and test the framework for care. It's provided through a new clinical support program specifically designed for autistic, transgender, and gender-diverse youth. The use of CBPR in the second example allowed researchers to gather firsthand experiences from the group and use this information gathered from the group along with existing literature in order to create very specific recommendations to these health centers. This way, they're able to improve the care provided. The use of CBPR in the final example allowed researchers to provide a structure for decision-making and community participation, all while making sure that they were able to emphasize a multivocal research practice, despite the geographical location of the community members involved. Overall, community-based participatory research design has proven to be very successful in ensuring that during the creation process of all these interventions, the opinions, values, and priorities of all community members are honored and included. Lastly, here are the references used throughout the progression of this presentation. Thank you so much for your time, and please feel free to reach out with any questions regarding the material presented today. Have a wonderful evening.